thank you, AK Company, for inviting me. Here they sell a lot of products. So today we are speaking about there is a light. Can we remove it?
Sorry.
Oh, look. Okay. And can we go down with the lights a bit?
It's a series of products with a high quality. I can be sure about safety and the high quality of this product. So I'm privileged to be here. Thank you so much, guys, for inviting me here.
We have seen manufacturing side, we have seen R&D, and we are really proud to represent this company in Italy for.
And it is a magnificent facility. The GCS company is producing skincare in both the electrical devices and in the skincare molecular devices range, and their facility is just incredible.
É com muita alegria e com muita satisfação que eu gostaria de parabenizar o seu Mr. Kim, toda a sua equipe, sua diretoria e todos os seus colaboradores por uma construção, um projeto maravilhoso como esse, que é a fábrica. Uma fábrica de muito bom gosto, muito bem construída, muito robusta, com equipamentos de ponta, com produtos de ponta. Parabéns a todos envolvidos nesse projeto.
So a global company that distributes all over the world, and I saw all the people here interesting. Always, I am a vascular surgeon. I look at the ankles of my patients, the legs, because it is something. And I was looking about how many indications I have for Ganafin in these ladies and men, because Ganafin is also a very good product for men. And I am honored to have here the director from a global company for skincare from Korea, that is Dr. Kala. Please, 1 second, doctor. Come on. Your hands. So, if you have, she's here from Korea, and she knows everything about polylactic acid and ganafi. So, if you want to ask something, you can ask her.
Nice to see you. This is Kara, director of the GCS. The GCS company is a manufacturer to the PRI filler and hyaluronic filler, and the lifting thread, all kind of medical device, especially the Ganafil to be supplied to NK. Anyway, today it's very happy to see you and introduce our products. So anything, if you before the presentation, if you have any question or any query for our products, just let me know.
Thank you so much.
Yeah.
Thank you. So now we start finally. So our team, Ms. Kara Parker from Korea, Belinda, Belinda is known all over, and Asif that is also here. You can ask what you want about marketing, and also, of course, me as a specialist in the product. So the Gana B and Gana X are the products that today we want to present you, because we have aging. And what can you do in this man, for example? You have thinning of the skin, loss of volumes, many wrinkles, so also the luminosity of the face is so important. So you can't approach this aging man only with Ganafi. It is an holistic approach. And the anatomy, as always, is one fundamental thing, and I started from the anatomical knowledge. Very quickly back to the basics, bones where we inject our products, mainly in the face, the maxillary bone, that is a huge bone from forehead until the teeth. The zygomatic bone, the temples, that is a place where many times we inject. Nowadays, in 70–80% of my patients are injected the temples, because it is a holy part, especially when we treat with botulinum toxin. Immediately you have an atrophy of the muscle, and so the temples has a very important loss of volume. And also, we know that by aging, we have a clockwise rotation of the skull, so that the forehead protrudes, instead all the maxillary bone retros. And this is why here we have so many tissues. And we have many skin abundant that we have sometimes to fill. This is an interesting article, very old, but very interesting, that I suggest you to read, because will imprint your philosophy of treatment of your patients. And also, here, this is another article that shows you how many loss of tissue you have in the face. The piriform aperture increases around 10–15% in high age, and this is why the nose also falls down. Temples, an area that is, so I told you, I inject a lot with some dangerous parts. The artery, the temporal artery just in front of the ear, many times we inject here, and the parotid gland. We don't have to inject our polylactic acid in the parotid gland. So we must remain superficial to it, and this is also very important. And the mandible, where we inject so many times. The rounds, the body, the branch, and all the nerves that you have in this area. Also, we inject fillers and also so-called lactic acid that remains a filler. According to the angle classes, especially here in Middle East, we don't have the third skeletal class, but we have a lot of second skeletal classes recruited. So I remember you, the first skeletal class where teeth, incisive teeth touch the superior, the second recruited, mainly here in Middle East and Far East, and the third that you see very rarely here, more in the northern countries. Then fat compartments where we inject really our product. Here, this is the dissection, and you see how superficial you can inject, and in this case, you see this is the skin. Immediately lower to the skin, there is the place where we inject our polylactic acid normally just over the mass, the musculoponeurotic layer, the superficial musculoponeurotic layer. Then, if you remove this superficial layer, you go in the deep fat. And also here, sometimes we inject the polylactic acid, but mainly in the subcutaneous tissue, mainly in the fat. Here you see also the zygomatic muscle that is a little bit deeper than the orbicularis oculi. And this says you why here in the periocular region we don't inject normally polylactic acid, because it is so thin. And so you can see some or you have an incredible hand that I don't have, or you can make some little waves. So also another, you see here how thin is the subcutaneous tissue. Another contraindicated area for polylactic acid because it is too thin. Good instead, all this part where you see how much thick is the subcutaneous tissue, the superficial subcutaneous tissue. Also, this is another interesting make the history. This is Norwich Pessa that says you that fat compartments are strictly compartmentalized. And so what you inject in the temples angioline will not travel to the mid and lateral cheeks. And what you inject in the lateral cheeks will not travel to the nasolabial folds. And this is very important, especially for hyaluronic acid, but also for polylactic acid, is so important. Deep fat, where many times we inject maybe with the needle, with a deep bolus technique, with the aspiration test before. And so what we do with polylactic acid, you see here only remove the skin, here only remove the superficial fat, not so skeletized, and here remove the deep fat. And this is, so the deep fat plays a fundamental role in the skeletalization of the face. Arteries, how many arteries do we have? In the face, temporal artery, facial artery, nasolabial folds. So pay attention when you use a needle. You enter in an artery very easy. Then, if I tell you my experience with Garnafil and all polylactic acid, I never had any ischemical problem. That is, you can have with hyaluronic acid. That is a gel. So, the polylactic acid quite now is diluted in water or in fine hyaluronic acid. So do not create never problems of ischemia. Anyway, a bruise, this is possible, of course.
Function as lymphatic outlet.
Here you see also what is
the angular vein actually, like I'm doing now. And I'm exposing
nerve and the facial
that is reflecting this also medially. And this exposes,
And this is also...
Which is this one,
sorry.
which we
I
turn
removed
the infraorbital nerve.
all the sound. You see here where we inject, you see here where is we need the levator labii alequinasi muscle here, and immediately laterally to it, immediately over to this, you see where is the infraorbital foramen, where also sometimes we inject. So here you have fat, here you have the deep peripheral space, and this is a place where many times we inject polylactic acid. Just to understand where we have to feel the face. Anyway, dogma. When you have deep arteries, inject superficial. When you have superficial arteries, inject deep. And then normally you mistake. The nerves, always I ask to my students in my university in Italy, which are the main nerves of the face, and you remember for sure which are the main 5 branches of the facial nerve, the 5 branches, tiny zebra spur of calories, tiny temporal, zebra sphygmatic, burn, buccal, more mandibular, calories, cervical. So remember that if you go down with your cannula or with your needle below the SMAS, you can damage a little branch, a little nerve. So better to pay attention on this. And the trigeminal nerve, that is the sensitive nerve. Muscles, how many times we use botulinum toxin, muscles of the face are so important to be known to be injected in the perfect way. Also the masticatory muscles. Here we inject a lot of polylactic acid. Remember that here we have the parotid gland. And if you go, it is a visceral muscle, so it is deeper, the deep fascia. But anyway, so superficial. If you go straight, maybe you can enter in the parotid gland, where nothing happens if you inject the polylactic acid, but better not, to avoid the injections. So, we have aging and the muscular aging. And when we inject, in which age we start injecting polylactic acid. As you see here, starts to be some aging. Of course, here the best. So, the aging problems here, especially in the mandible, you see that are starting. So, 30s, 40s, depends on the patient. Because we are treating skin laxity, not only polarization, but it is not the same patient as you inject with hyaluronic acid. Normally it is a different patient, where laxity starts to act. And so you reduce laxity, because what you have really is the formation of collagen, of new collagenesis, and a slightly fibrotic collagen. So you have a lax tissue, you create fibrosis, and if you are good doctors, if your hands are good, you get a new subcutaneous tissue, more stronger. This is what we do. Not with hyaluronic acid, we only give polarization. We can give lifting if we inject here laterally, but we don't get neocollagenesis. Yes, we get neocollagenesis, but very few. In this case, everything is based on neocollagenesis. So the volume you get is a new collagen, and a particular collagen. And so this is the target that we have. Anyway, remember that we have the superficial dermis and that epidermis in the periocular area is 0.05 millimeters, nothing. The dermis is 0.3 millimeters, again, nothing. And so the total thickness in the eyelids is nothing. And so if you inject these areas with a very thin skin, it is dangerous. and makes a contraindication to all polylactic acids. Polylactic acid is particular material. It's not, totally not as hyaluronic acid. It is a different way. And so you have to understand where avoid injections. Yes, in the skin, strategy where we inject also our polylactic acid. Well, in the last 3 years, we presented this, I presented also this new strategy. Now, this is the line of ligaments. What is the line of ligaments? We have the face, we divide always the face in upper, mid, and lower face. This is known, everybody knows. With the line of ligaments, so the temporal adhesion, the orbital thickening, then the zygomatic ligament and the mandibular ligament, we divide the face in medial and lateral face. And this is a new division that says us that if we inject our product medially to this line, we volumize and we masculinize the face. If we inject laterally to the line of ligaments, we lift the face and we femininize the face. And this is a very important strategy, new strategy, injecting everything, also, of course, filler. If you inject laterally, you get more. And this is an article that I published with Sebastian Cotofani, that is a good friend, where you see that if you inject here, you get the best lifting if you inject here, because you have different layers. In the lateral face are all parallel, the layers, instead in the medial face. No. And this is another interesting article that says that when you treat the medial face, normally you volumize the face in more important. And so the practical conclusion is that I injected normally first lateral face and the higher face to get a lifting of this part, and the upper face. And the aesthetic principle that temporal lift is a working strategy for the lifting of the mid and lower face. So always I start injecting the temporal region medially and laterally, and then the zygomatic region, that is also very important. And this is the quantitative analysis of the treatments that is really interesting. I suggest you to go and read these articles. So, this is the technique where you see we inject not superficially but deeper in this part. The Mara fat also we inject here and in the superficial where you have a lot of septa. And also these septa with our camera will be broken before injecting to get a more important lifting. And so which is the perfect indication? Every patient can be injected. Well, here you see the 3 units that I described to you, and the perfect indication is the mid-lower face. Using Garfield, light history, well, it's polylactic acid is not a new problem. I published the European recommendations for polylactic acid back in 2014, so long time ago, around 9 years ago. But new field and Sculptra were released on the market in the 80s, so it is quite 20 years that I use polylactic acid. Ganafil was released in 2014 by the company in Korea. In 2015 completed the medical device manufacturing and was released with the CE mark in 2019. So it is a product that has 5 years, so we have a longer history of this product. We have two different products, Galabi and Galax. Galabi for the more lethal indications, face mainly, but also neck, maybe arms, that is 210 milligrams, and Galax that instead is 630 milligrams. This diluted with 40 to 50 ml, and this instead diluted with 15 ml up to 17, 18 ml. What is polydactic acid? It is polydactic powder, so you have to dilute it. And this is the first difference with hyaluronic acid. You must dilute it. Sometime before you inject it. It is not prepared. You can dilute more or you can dilute less. If you dilute immediately before injections, you have a lot of polylevulactic acid. Many polymers. Polymers are strongly effective. The more you leave it there, the more polymers become monomers, and so less aggressive. So if I have to treat an HIV patient where I want a lot of power, I dilute 10 minutes before, half an hour before. If I want a nice lady for a cosmetic purpose where I need no problem, no volume, only a light volumization, I dilute maybe the day before. And I get more monomers that are a little bit less aggressive. Okay, if I have an HIV patient, I treat a lot. In Italy, I dilute a few moments before, because I want many polymers. And what you inject is not the volume that you will have, but it is something similar. So always they say, you sculpt the face. You see which is the best result in that moment. Then, if you have diluted with hyaluronic acid, you will maintain this result until 1 month, because you have a hyaluronic acid. Then hyaluronic acid decreases and increases in the meantime the neocollagenesis. And so your final result will happen in 1 month. And this says you that you can't inject every week your polydactic acid, but you have to wait that the first vial has given the effect. So I inject normally once per month, once per 45 days, to arrive to the final volumetric result. The same is bolus. I don't inject normally 3 vials in the same time, but this is me. There are doctors that inject everything in the same time. I prefer to get a result a little bit in a slower. So this is the collagen that you get. You have the mechanism, an immune reaction, and then you have the activation of fibroblasts. And so a new collagen that finally gives the volumetrical result. Well, until now, until a few months ago, we diluted with sterile water. But nowadays we have the possibility to inject, to dilute it with hyaluronic acid immediately, to get the volumetric result immediately. It is a particular hyaluronic acid, 5 milligrams, And you have inside the confection, you have both the Ganafi product and the hyaluronic acid to dilute it. Then this is on level. Then I add off level some lidocaine in the same vial, normally 2 ml, 3 ml in the Gana X, to get some anesthesia. So you do the first 2 channels, wait a second, you get some anesthesia and it becomes not too much painful. Anyway, now that we inject without sterile water is very painful. So you had to add lidocaine to reduce the pain of injections, otherwise sterile water is very painful. Now, with hyaluronic acid, it is less painful. This is the combination manufacture method, and so this was the result. No? You have immediate feeling due to the water that you injected. Now you have an immediate feeling due to the hyaluronic acid. And so this volume will be maintained, and you don't have this loss of volumes after 2-3 days that you had before. And so this is the diagram of the results. The hyaluronic acid, the ancient weight dilution with the water that you get the result at 6-12 months, but normally in 1 month. Then to get the final result, you have to wait 4 to 6 months. Because you have a particular retraction of the tissues that is a particular that you get in many months. The biggest polylactic acid volume and contouric effect arrives in few months. The microspheres that are floating around 30 to around 40 microns are the best one to give no inflammation. What you get is an inflammation. But if you inject widely, the rate of inflammation is very low. So you don't have to make cumulus of product. Because if you get a cumul, this will get a cumul of collagen. And this creates the so-called novus that we're gonna fill up very late with the old polylactic acid with very frequent. Very frequent because there was a bad technique that nowadays we know how to avoid. The appearance, because it is a powder, while here is like, I don't know, a cake. It is condensed inside. And this is instead a powder that you can dilute. You see, it is not pressed inside, white and right, that you dilute with hyaluronic acid or with water for injections, sterile water, not physiological water. Normally I use sterile, and this is written in the internal SMPC. You see the dilution 10, 15, half an hour before, but also 10 minutes are enough. But normally I prefer to apply emerald cream to the patient. Then I wait 30 minutes to get the result, and in the meantime, my nurse prepares the product. And there is a total difference in the preparation of ancient preparations and the dissolution method. That is, now we are preparing the products already prepared now, and so that when I inject in half an hour, 45 minutes, it will be ready for, so it was not prepared yesterday. If you want, and you are beginners, you don't want to risk the list, you can prepare 2 hours before. Many patients arrive in my office because I know they come, what I have to do, I prefer really 2 hours before. You can without any problem. And this is the difference with, you see the injection with the cannula. So you don't have you have an immediate result due to the water, but the really final result you give in the 1 month, 2 months. That is so if I need 3 sessions, for example, normally I do the first session, then the second session in around 1 month, and the third I see that patient and I decide what to do. And the number of sessions, of course, depends on the defects that our patients have. So this is the right patient, you know. I say always that the dehydrated apple. You leave your apple on your in your kitchen, and the apple in 10 days will disintegrate. You can treat all these little wrinkles with hyaluronic acid, and you will have a disintegrated apple without wrinkles. Instead, you can go in the middle of the apple, give volume, what we do with polylactic acid. We will not treat any single wrinkle. We treat the wound effect, but we will have the disappearance of wrinkles. And finally, we will have an hydrated apple without wrinkles. The philosophy is totally different. We don't treat superficial wrinkles, but we treat the area of defect. Of course, I said you the preparation of the products, sterilized water, or now we have hyaluronic acid, must be mixed to increase the dissolution, and here is written 1 cc of lidocaine. I inject also 2 cc of lidocaine without any problem. Normally, but this is up to you. You can also, with hyaluronic acid, do not use lidocaine, because lidocaine, you have some allergies, some problems, you don't use. No problem. I use always, but I ask my patients if they have any allergy. Normally, no. And so, you can add or not. It is not written that you must use it. You can also do an anesthesia at entry point and finish, and you don't use anesthesia, because I normally do only numbing cream. Many times I don't use numbing cream. In other countries, there are some techniques that are done with the sedation of the patients. Normally, I do all my videos are without any sedation. Then you can decide what you want. Use distilled water only. Now, this is a little bit to update, because we have the hyaluronic acid. Widely, evenly, deeply, strong massage. Yes, this is another particular detail that normally I take 15 minutes. I teach my students that they must massage the part for 20 minutes. So I put the cream once and then massage. Second time cream, and third time I ask the patient to massage, so that they learn how to massage, because it is important. And they must massage twice a day for 10 days, in the morning and in the afternoon, to get some results. Maybe you can have some swelling in 2 or 3 days. You can use some ice pad, yes, if you want. Normally there is no pain, normally, but maybe if you have pain, you can use some anti-prolific drugs. No problem, but quite never. In order avoid granulomas, do massages. Quite all the nodules after polylactic acid are capsuled bruises. So you get a bruise, you don't massage, and this makes a capsule, and then you have a nodule. So please do the massage, and this avoids quite all the nodules in the face that you can get. Do not create any problem with the massage. So if you massage 2 or 3 times a day, it's very good. So improvement of the face, Ganavic is the best improvement of the face, 15 cc and 2 ml of liquor. This is my way of dilution. Who must be injected? This patient, what we do in this patient, these products that are also magnetic problems, a difficult patient. This is the result after 2 sessions of this patient. There is a nail, very swollen here. Which is the treatment? Maybe surgery, a cervical lift. I don't know. Big nose, many problems. A paralyzed patient. Very thick skin. This, you see, when you have loss of volumes, but this laxity. And this laxity characterizes not so many patients. This is a very good patient. This is the final result after some sessions, but also botulinum toxin, also connected for this patient. Another wonderful case that you see, you can, I don't know if you can get this result with a surgical intervention. The filling of tissues and the following the lifting, medical lift that you have, because the tissues are a bit retracted, it is only characteristic of polylactic acid. This lady in the 30s that wants to remove nasolabial folds. Very frequent case, and you can get some good results. This lady that is in the 50s, 60s, has done a huge oral rehabilitation, and then asked, what can you do? And I have beautiful teeth, and you leave me with this face. So she needs to be filled and to get some neo-collagen. So this patient that is swollen here, no wrinkles, nasolabial folds, totally absent. What do you do? 1 filler here, 1 ml. It is too low. You have to inject 3-4 ml, and every 4 months you have to renew. Because if you inject hyaluronic acid, I don't know your experience, twice in a year, you must renew. Instead, the philosophy of Ganafil is different. This patient that is atonic, she moves, you see the laxity here. This is the perfect patient that has the indication to do Ganafil. No? I say to her, don't smile. Yes, doctor, I am not smiling, but she smiles anyway. There is no way to, and then she has this laxity that can be treated with threads. But with threads, you have a softer tissue, and threads results will disappear in 2 months, 3 months. A surgical lift, but also the surgical lift, if you have lax tissues, will remain for a few months, maybe 1 year. Then you have to get, instead with polylactic acid, you get more fibrosis, and this fibrosis is very useful for the patient to get to reduce laxity. This patient that you see, the festoons, the neck, this is the perfect patient again for polylactic acid with this, you see this triangle of loss of volumes that can be more than 50 years old, 60. This is 45 years old, not so aged. But the skin has these characteristics that you can get good results. Emma cream, numbing cream, before I never use anesthetic cream locally. I don't use blocks, never in the face. And I inject directly with a cannula, 80%, but also with the needle, sometimes to refine maybe little points. This is Garavi, the face indication, how to dilute, remove the cap. I inject slowly your water, sterile water, shake the vial 10 minutes. There are many machines that can be used, and you can use a machine. Many times I shake with my hands. Because remember, with polylactic acid, you have a suspension. You don't have a solution. Because the polylactic acid is not a drug that can be dissolved totally. It is a suspension. And so every time when I am injecting, I shake the product to maintain an even suspension, even if with Ganafin is very easy. This is the new dilution with hyaluronic acid that is in the confection. You have both Ganafil and your hyaluronic acid for dilution. What makes easier the injection? It is more soft and a little bit more steady the injection. What does it mean? That before you add water, and when you inject water through a 23 gauge cannula, it is very easy. Instead now with hyaluronic acid, it's a little bit more thick. And so it is much more difficult to inject a big quantity. So you have to inject, now we see, if we inject 4 centimeters, normally I don't inject more than 0.1 ml per centimeter. So 0.4 ml. 0.4 ml. 0.1 ml is a little quantity that you inject. If it is water, it is very easy the first time to inject too much. 1 ml, for example. Instead with hyaluronic acid is a little bit thicker. And so the pressure that you have is not the same when you inject a thicker hyaluronic acid that you have to push to inject. It is less, but it is not like water. So it is a little bit better, in my opinion, with anesthesia. I told you, and cream, the puncture, the entry point for the cannula, 21 needle, 21 gauge, but also 18 if you want. 18 is too thick, in my opinion. Normally I use a 21 gauge and a 22 gauge cannula. For 70, that is perfect for the face. From here, you arrive all over the face without any problem. 21 gauge cannula, but I also use 23, 22, 23, subcutaneous layer. So, subcutaneous layer, don't go deeper the mass. Even if here, for example, I go down on the bone and inject deeply on the bone with a bolus technique without any problem. But normally with cannula, I remain in the subcutaneous tissue. These are the main treatment areas. You see, forehead, expert doctors. I don't inject forehead, no. I inject forehead when I have a volumetrical problem. So this depression may be down on the bone below the muscle, gliding on the periosteum. But normally the mid and lower face are the best indication for therapy. Preauricular area, you see, sometimes double dilution. So the philosophy is that I have to inject my 21 milligrams. Use water, use hyaluronic acid, use what you want. Finally, you have 210 milligrams in the face. That must be given. This is the philosophy. So, one channel, all the product. No. 100 channels with a very low quantity of product. This is the right philosophy. So, many channels with a very low. If you dilute twice, you will distribute more evenly, because in each channel you leave less product. And so it will be maybe some little swelling just done, but for difficult areas, much better to dilute twice. For the neck, dilute twice. 2 times. For the hands, 2 times. For the buttocks, 1 time. I want volume, I don't dilute twice. But for the hands or for the internal part of the thighs and so on, I dilute 2 times. So the philosophy is, I am beginner, I am starting, dilute twice, no problem. You inject a little bit less. If you have good hands after some experience, face 101. Hands 102. Sometimes also 103. I dilute 2 times more than for example, for the internal part of the thighs, I dilute a little bit. Subcutaneous tissue, if you see bleaching, stop. If you have too much pain, stop. You don't have to inject in one injection, but you have to inject slowly. Take your time. To do a good injection, I take normally in my clinic half an hour. But also the first time 45 minutes to study, to do the anesthesia. And if the injection is hard, means that maybe the needle is closed, the cannula is closed. Don't push, because if you push, explode it, and then you inject a big amount of product. So when you inject, it must be very free. You inject, it is closed, no problem, you exit, you change a cannula and you put another cannula, another needle. Don't push ever too much. And shake frequently, because you maintain an even dissolution. And I inject frovectors, because you will have a retraction. You will have you do this vector, and this vector will in months retract a bit, like happens with a fibrotic collagen. And this retraction gives you a lifting that you don't have with any other product. So it is very useful to get this. Well, so my main vector is this, and also maybe this, but few. The main vector is this, to get this retraction that you will see. So that is normal that you do the picture right after, and you see a good result. The patients are incredibly amazed by the result. Then, 10 days later, decreases, and then you do the picture 8 months later, and you see the result of it 6, 8 months later. And so you have to advise your patients that to have the final real result, like with rats, yes, you have a mechanical result immediately, but then to have the real result, you have to wait 3-4 months This is normal in the result. Temples, difficult. How to inject? I remember you that you have here in front of the ear, the temporal artery, here below the superficial fascia, around here becomes superficial and runs in the superficial fascia. So, or you go down deep on the bone, or you go in the subcutaneous tissue. If you go in the subcutaneous tissue, you have to inject a very light product, because here it is immediately visible. Here, yes, but here. So difficult. In my opinion, you start with the mid-lower face, and then you arrive to the temples. I use normally this technique down. You see the vein. You inject the vein. No, you avoid the vein, of course. If you go down, this is the zygomatic bone. You go immediately up to this. Otherwise, you have the zygomatic, then you inject too high, you have the pressure in the middle. So you must be even. And so normally, you see, I go down here, down on the bone, and I inject on the bone. Where normally there is, I am on the bone. I don't push like a buffalo, of course, because I know that there is the bone. I don't go down. I go down, I feel the air, and I stop without pushing. And I inject my product there. Many times also I use this, what I can call this fan technique from the same entry point. You see, this is polylactic acid, of course. I use normally a 3 ml syringe, that is very good. And this is a 23 gauge needle. You see the blue needle, 23. Like aspiration. Down on the bone, there are no arteries, no veins, but better. I do always like aspiration. You see how much product I am injecting. So, I have my rule that it is 0.2, 0.3 ml for each square centimeter. So means that I have 2 centimeters, 2 centimeters, 4 square centimeters, 0.2, 0.8, 1 ml for 1 temple. That is a huge quantity. Then I use also here, you see this, this is an anterograde technique, but you can do this with a cannula, 23 gauge cannula, that is perfect, very easy. You do the entry point, you see that I am injecting anterograde. So I enter, I inject the right quantity of water, and the needle proceeds in the water, so that you don't get bruises. It is a particular technique, normally very easy. And this is a very important part to get the lifting. This is a man where I wanted to masculinize. But anyway, this part is always over the parotid gland. Here you have the parotidocutaneous ligament that takes this down. And here you have many times a huge depression that with polylactic acid you can inject in a very good way. And the mandibular edge. This is really a lifting technique. This man didn't want to undergo a surgical lift. And I don't know if he had the indication for a surgery. He was empty. So the possibility is a liposuction, a lipo with microfactor, but this is much more difficult, no? Yes, microfactor fat is interesting, it has good results, but it is a surgical procedure. This is so easy. You prepare a little step more than hyaluronic acid, but anyway, very easy. And the massage, immediately. I ask my patient, to take a head and then massage. And in the meantime, I am working, but important, the massage to avoid bruisings, to avoid, and then also because the patient is, after the first injections, you get some anesthesia, and so the injection becomes really very easy. Nasal for any question. If you have any question, ask me. Drink some water. That you hydrate yourself.
The massage doesn't cause asymmetry?
The massage didn't ask her.
Doesn't cause asymmetry? She means to say, wouldn't it go to some other place?
It moves. This is what. Yes, moves a lot. So, when I massage, normally I teach my patients how I massage. Then, honestly, in my office I have some nurses that are not trained, and they do massage. I teach them because the massage is fundamental. I injected it here. I want that remains there in half an hour, 1 hour, keeps more solid and doesn't move then. But in the moment that you move, I massage here and I check if there is any bump, because this is a bruise, no? And so when I massage, for example, I want always to go a little bit laterally. So if I injected too much here, and when you are a beginner, can happen, it's not so immediate, no? I massage this way. So this, and you can put your water from here, you put higher, not from here to there, but a little bit more. So yes, you can massage, and you can massage in a way, not this way only. If you want to maintain here, you massage this way, and you maintain where it is. But you can slightly move, like you can do it, because you put there and remains there. Mainly the massage is done to avoid nodules. This is fundamental. You massage, you feel a nodule, you feel it up, you massage it until it disappears. This is the main, and then the first time you inject a polylactic acid, you will see that in a point you have a little bit more, in another point you have a little bit less. No problem, you massage and it will get very even after the massage. 15 minutes, it is a lot. So you have to inject 0.1 for each centimeter. You inject your product. Finish massage 15 minutes, 20 minutes. And it is. And I suggest you to teach the final cream, because I use cream, of course, hydrating cream is very good. The final massage is done by the patient, so that they learn how to massage. Otherwise, they don't know how it's done. It is a deep massage. It is a strong massage. You can't, if you do you put you destroy your work. This is impossible. But you can get an even. Okay, so the massage is the fundamental. Nasal folds is also a very interesting, sorry, the video doesn't move. This is the fine technique, subcutaneous tissue, very easy to be done. Take a note on how much I do inject. Very like one. You see, for each channel, I inject 0.1. Very little amount. So you enter, you start injecting, when start moving, you come back. It is 2 movements in one. And it is a bit to be learned. You see, I inject a little bit. You enter, coming back, you inject. You see, she's feeling pain. A bit. She's not crying, she's not jumping, but she's feeling it.
She's expecting
But
that.
The pain, the most important pain is due to the water, not the needle, because she used the water is painful. And so with the lidocaine you do the first, second, third, and you stop. Before the patient says you, I doctor, because you do the first, second, third, you stop. And normally this is very well accepted. Also with cannula, it is less painful than the needle. You go 1, 2, third, I stop. Because I know that the patient can support 1, 2, the third injection is too much. Like when you do CO2 fraction. No. 1 point, second, third, I stop. Because I know that the patient is pain. And so needs to rest a bit before.
I have a question.
Yeah, please.
How much results normally recommend for a face like me just for the collagen reduction? Like normally what would be the range? 3 ml, 15 ml, because I saw a slide, it's written that 10, 15 ml for whole face. And if I have to inject cheek area only, then how much would be the safe and low?
Many times I collect, you don't need, you are already too beautiful, so you don't need any treatment. If you say me, no, I want to improve the skin, it is a very good indication. So skin tester, not organization, you don't need the 15 ml. And so normally I collect my 3-4 patients, 1 by a gamma treatment, B, because it is a battle. So I enter with my sterile syringe, I take 2 ml. For away, other sterile syringe, second patient. You can do. It is not written inside. Inside it is a 1 single use, but it is like botulinum toxin. It is a vial. You enter with your syringe, you throw away other patient. I use mainly this portal for 5 patients. No problem. Ethically is correct. So for you, I say, well, I use 1 ml, very superficial, higher, not in the dermis, but higher. And how much? Not 0.1 per centimeter, 0.5%. A very little quantity, very well distributed. And yes, you are a very good indication for all the skin texture. You are already in the 20s.
Sorry.
You are already in the 20s. So from I don't ask your age, of course, but from the 30s, you can inject once you see, okay. Then other patient, then I have maybe another patient for the neck. So one single bottle can be used for 5 patients. 18 ml, yes, not less than 50 milligrams per ml. This is normally my way. So for the lower pains, a little bit nasolabial, we also normally divided the vial in 4. Max for 4 patients, so this is my way. Otherwise, if I have a patient with bone medical loss like me, I have for all the face.
And can we use the same product for neck as well?
This also for neck. For neck, I suggest you to dilute a little bit more, because it is a difficult area. Then we are to contraindications. A very thin skin, contraindicated. Because from the thin skin, you can see little bumps. It is in a thick skin, no problem. So neck, hands are a second level indication. Not for experts, but to be very cautious. This is fundamental.
One last question.
Please, I am here for this.
God
Not when I am in
forbid-
Milan, but when I am in Milan, you can write me, and I answer again.
Thank you so much. If God forbid, patient comes back to us with a lump, then how can we manage that lump?
So, after what I have told you, if you get a lump, it means that you have it for an enemy, and you inject it in the wrong way. You don't have to have lumps. No, there are no lumps. But anyway, if you have a lump after 1 day, it is a bruise. You massage it very well and you stop. If you have a lump after 2 months, no, you mistake something. But in the last 10 years I didn't have. All my students didn't have. You have to inject very prudently without making lumps. If you feel that you made a lump, you have to, I take many times some water. I dilute it and then massage. You can't have a lump. With these dilutions, it is impossible. You have to inject 1 cc in 1 point. I hope that you will not.
Thank you, sir. I have one question, please. You told like the technique should be first to the lifting part of the face, and then you move on to the volumetric part of the face. But if the patient is predominantly this volume loss over here, what is saying, yeah, then what will be your
the lifting technique, injecting laterally to the ligaments line, is something in which you must trust. I took maybe 2 years to really trust. So when you have nasolateral fold, you don't inject nasolateral fold, but you inject laterally here and the zygomatic part. I was not so. I trusted it after many treatments, injecting here and looking that this disappears. Because your patients pay. And so you do an injection here to this, so you must trust this. But really, trust me, I published my casuistic 2 months ago about the lifting technique laterally, 50 cases, with all the on Prime. If you want, you find in my ResearchGate, I don't know if you go in ResearchGate, that is a social media for scientists. You find all the doctors in the world, from Korea, from Italy, from all over the world, and you can chat with them. You can ask the article, very beautiful. Subscribe ResearchGate because it is an incredible, and you find this article incredible. And they had an incredible result, so works. Inject laterally here, the preauricular area, all of the here is the new way to attend, of course, not all the patients. In some patients, you have to inject also nasolateral fold. In some patients, I take 1 vial of hyaluronic acid and they inject the leaves. The codaringas, not with ganafin. You have to inject them with another, or botulinum toxin, or you have to finish your patient. Chin.
Excuse me, I'm so sorry. Would you give me a few seconds? So,
It's ready. Okay. And then continue. She's for the face. 1 second, I arrive. So I finish the face, and then we do in the afternoon the Botox, we injection for the body. So I wanted only to say that very good for asymmetries. This is an interesting, just to check the philosophy, I show you. The patient has EMLA, is ready to be injected.
I didn't apply because I managed to get 25 gauge needle and cannula.
Yeah, but some EMLA, why not? It is not a contraindication. Apply EMLA. You see, look, sorry, just 1 second. You see, I am injecting with a cannula, 25 gauge. Very easy, no? And I am injecting below the line. To check the result, they mediate the result that you get, no? I injecting here down, injecting there, okay? And you see they mediate the result after the injection, finished. Okay, subcutaneous tissue. And you see here the result. They mediate the result. It is so impressive of the jawline. If you inject below the line, for example, me, here, I don't have any problem. Here. My problem is here. So remember that where you inject polylactic acid will give you the result. If you inject in the wrong way, you paralyze the patient. But this is also with the hyaluronic acid. Same, you have to inject here down and not here up. Okay? Massage, final massage. I do always the massage, strong massage. It is important avoiding lumps. If you have a lump, be sure you have done a mistake. This is. Okay, so now I go to inject my patient. 2 minutes, 5 minutes. Instead, I already here. You must be ready to everything when you do master classes. 5 minutes. And so I go for the considerations. That is, so, contraindications, thin skins, mimetic skins, not good. Thick skins are good. These are not too thick, but not thin. This is a lady, you see, if you have incredible hands, you are very even, but I am not Leonardo da Vinci. And you are not Leonardo da Vinci, for sure. So, avoid too thin skins, autoimmune disease, permanent fillers, all these are contraindications. If you have an arthritis that is taking cortisone, not a good patient. Chemotherapy, not a good patient. Wait that she has finished. Reactions always are possible. Well, I never had these inflammatory reactions. I did a mistake, maybe, but normally it doesn't give any. And if I inject very even, I don't have swellings quite never. It is a very safe problem. The material, the problem are your hands, but the material is very, very safe. Anticoagulants, yes, of course, use cannula only, don't use needles. Better cannula and use only that. That is the best way. Safety and effectiveness, of course, I don't know you, but when a doctor asks me, what do you prefer? Safety or results? Everybody says me, well, safety. No, I follow results. I want results. Then, of course, there is some problems. There is some dangers injecting. If you don't want to have dangers, don't do surgery. Go to the supermarket and then you do with your husband or your wife, you buy something. And also there are some dangers, also at the supermarket. So I follow results, always. Following also safety, but I try to get good results. Reactions, I say you, in my opinion, there are not big reactions, and it is not an infection also I didn't have. If you disinfect well, normally is not. Ice pack for 1 hour, I never do. But if you want, you can do. Remember that the Ganafil you don't put in frigo. It is room temperature always. Without, and also when you have diluted, if you don't use immediately, you use in the afternoon, don't put in frigo. When you take back, you shake and finish without and the patient must massage twice in a day for 10 minutes. If you ask 10 minutes, the patient does 1 minute. So normally I suggest half an hour in the morning, half an hour, and if you don't do, you will die. In this case, maybe it does 5 minutes in the morning and 5 minutes in the afternoon. Otherwise, it's always very difficult to convince patients, but instead, in my opinion, it's important. Growth of collagen varies. If you smoke less sun exposure, I suggest them not to expose to sun, especially if they have some bruise, because it will get an hyperpigmentation. So better. Some results. Okay. This is an interesting. And immediately after 1 month, with hyaluronic acid. You see that the result is, you see, the interesting after 4 months, but immediately after you see that you have a good result. Tendons is a very good area to be treated. So interesting. Then the patient this patient, for example, is a particular. What do you do? Hyaluronic acid. The skin texture. What can you do? No? Peelings, laser, fractional laser, but it is loss of oil. This is the result with PLA after 4 months or 5 months. You can't get this result, volumetric result with a hyaluronic acid, because you don't change really the skin. When you are ready, I come.
Yeah. Maybe you're doing it is just face finish and then go.
I finish
Yeah,
here.
finish face.
5 minutes. My boss. Profilo. Well, there are many hyaluronic acid. Profilo is a very good marketing strategy, but honestly, I prefer polylactic acid because when you really restore the tissue. Profilo has different hyaluronic acid inside. You put in some places where you can use this. The strategy can be good, but don't say either Profilo gives collagen, because it is not true. It is not good. And there is no publications on this. Then, if you normalize the taste with Profilo, very good. With I don't know, another filler, very good. When we hit the filler at the only product that gives neocollagenesis is polylactic acid. Also, calcium hydroxylase doesn't give the result of, you can use radius, but after 1 year, it's finished. Also, polycaprolactone. This is totally resolved. What remains is the collagen that we produce. This is reabsorbed in 8 months or 1 year, no more. Then finished, you don't find any more oil inside. The collagen that you produced, yes, this is found. But collagen, not the polylactic acid. Is totally resolvable. I think after 40 days, 30, 40 days, this is, you see the patient, you see what she needs, and you have the second session. Every 1-2 months. Many incredible results. These important lipodystrophies are incredibly effective with polylactic acid. Very good. I didn't do only polylactic acid, but also botulinotoxin, NCA for the lips. Okay.
We're kind of on the safe side because we have had a relation in our hand in case of any vascular phenomena. But in this case, even if we keep in consideration the vascular anatomy, still there is a little bit chance we might inject the artery. So how can we keep ourselves safe, or how can we reverse this if we inject it in an artery?
I told you, when you do an injection, you inject slowly. If it reaches, you don't inject. You use a cannula, thick cannula, not 27 gauge cannula narrow, not 30 because it doesn't pass that anyway dangerous. I use a thick cannula. All this makes this treatment very safe for ischemic complications. So my opinion is how long is it? High G prime can be used in the most. But also here, with a cannula is not so dangerous. So there is not the 100% safe treatment. Always you can get. But ischemic are very, very...
We cannot reverse it if we inject it in artery, right?
What?
We cannot reverse the thing, right? Like in the case of hyaluronate acid, we inject the hyaluronate acid and
Here you can inject anything to dissolve if possible, but the particles of polylactic acid are 40 liters. So if you also inject in an artery, never cause me any problem. Because are too little, and so they don't block like a clot of hyaluronic acid. This blocks the artery. Hyaluronic acid instead this not. If you inject in a volume technique, you can create some problem. But in this case, I am down and I put aspiration pressure. If you are in rain, you doesn't use it, and you don't inject it. Okay. You know that also relaxin could be used for this. No, if you see the movement here, no, go down. You see the movement, close, up, close, relax, relax, up. You see that goes down because great gluteus is moving this way. So maybe injecting this part, this will go down less, and so could be a possibility. Okay, I prepare the usual, no? You see?
Doctor.
Okay, disinfection. Anesthesia. What I do a little injection. I do a little point of anesthesia. I do a little hole, and from here I go and I inject with a cannula.
Perfect. Thank you.
Did you sign up the informed consent?
Yeah.
Did you understand everything?
Yeah.
Good. 18 gauge me? Oh, good. Thank you. Okay, little anesthesia, superficial. You see? Papule, perfect. Papule. Okay.
It's not ready. They will bring it. Which one you the first name? 19?
Wonderful. Okay, so one for one side, one for the other side. Perfect. You give me you prepare the 4 syringes. Possible that you will have little bruise, it is possible. Quite what can happen.
This is ready, right?
Okay. Again, cannula, 70/19. My vial. Closer, very well. Perfect. And we start. You see, I enter 1 centimeter, turn, good. First, second, again, very easy to enter, and then some subcision. You don't know how much of projection this subcision gives you. Nowadays, I do always also for face. You see? Very good. Perfecto. Where is the hole? There is not the hole. Ah, no, found. Sorry. You are a friend of Belinda. Yeah?
Just a little bit nervous.
Okay. Very good. And where is? No, it's here. No, this is, where is? Neither. If you don't find it is not a big problem. You redo, maybe you didn't do in a good way, and then you enter easily. You don't have to struggle. It's possible that you will feel some little pain when you sit down. You are driving today?
No. Taxi.
When you sit down for 1-2 days, is normal.
Okay.
Do you have
More to go.
one more? Beautiful shape, I guess. I like. A little bit more flat this. I will do another wire here. This is stock dilution. So it is 42, 43 ml with Lido for 630 milligrams of PLA. This part I want more round, so I enter again. Okay, good. Okay. For Botox, I strongly suggest you to use a 19 gauge cannula because it is very beautiful, very strong, very